Hi, everyone. Thanks for joining today. This is Rachel Pickering, Senior Product Marketing Manager here at Imprivata. Today, I'm going to go over a brief overview of Imprivata Mobile Device Access, our solution that provides fast, secure, no-click access to shared Android devices in a clinical environment. Today, we're going to walk through a couple of things. First, I'm going to highlight some of the challenges that organizations face when implementing shared use mobile technology, specifically around finding that balance between security and convenience. I will walk through at a high level some of the benefits that Imprivata Mobile Device Access can bring to both IT and clinical users. We'll show a quick demo so that you all can get an idea of what this workflow looks like and how folks will interact with it. And then I'll wrap up by sharing some successes with customers that we've had in the past. So with that, thanks again for joining, and let's get to the presentation. Before I talk about our solution, though, I want to highlight a little bit of the problem and the challenges that healthcare organizations struggle with when managing Android devices in this shared use model. So when I say shared use too, what we're talking about is a clinician who's picking up a device for the day, assigning that device to themselves, and then using it for the different workflows, whether it's bedside care, med administration, any number of those activities. But the difference is at the end of the day, they return that device, and they may or may not get a different one during their next shift. And so managing these devices in that shared use environment where you want that one-to-one user experience on a device that could be in the possession of any one of your employees or nursing staff, that can become difficult to manage for a number of reasons. They're getting into these devices to access critical tools for care delivery, but that also means that there's patient health information that is used or stored on those applications. And so you need to have a way to really accurately track who's interacting with these devices, as well as add certain layers of security to ensure patient privacy, HIPAA compliance, and to ensure that you have that right identity tied to that device. So when somebody's logging into, say, the EMR application, they're confident and they can be sure that they're charting or doing work under their name. As these devices exchange hands, you start to open up risks like not just poor visibility of who's having these devices, but also accidentally engaging with patient information or an application under the wrong credential. So you've got to lock these devices. You've got to think about them as if they were any other shared endpoint in your environment. You put a lock screen on that device, you tie off access to patient information from unauthorized users, and you ensure that you know who's getting onto these devices. The problem is locking the devices, while it can improve security, it requires users to enter a password to access. That's an extra step. So a lot of times what we see is that folks leave the devices open for a lot longer than they need to, or they do things like shared PINs so that they don't add additional burden of more password management, more manual authentication to their clinicians. That's not a great experience. You lose that auditability, and you lose the ability to have a more personalized experience on those devices. And while it improves security, right, so if you do security the way you should with strong individual credentials, that can cause burden. You think about how hard it is to get in and out of a workstation, a desktop or a laptop over and over again each day. Now you're on this tiny form factor mobile device going about the floor of the hospital. That can be cumbersome enough as it is getting in and out of that device all day, but when you expand that into all of the different applications that you need to access that have varying levels of password complexity, that have varying degrees of security, meaning some may have shorter session periods than others. So when you're looking at something like an EMR, oftentimes we hear that when an organization isn't locking down the actual devices, they're logging users out of that EMR after 10 to 15 minutes of inactivity. What that means is that a clinician is having to go back in and re-authenticate into their EMR pretty much between every single patient. So that frustration can really build. It can make it difficult for them to get access to the tools that they need and ultimately hinder adoption of these mobile devices. And so we know that we need security, but we want to make sure we're able to enable that security, we're able to enable that auditability in a way that doesn't interfere with clinical workflows. And so for those of you who are familiar with Imprivata, we know that Imprivata has created this really great digital identity framework that is now extending into these mobile workflows with Imprivata Mobile Device Access. With Imprivata Mobile Device Access, organizations can rest easy knowing devices are left in a proper state every time. The comprehensive solution enables secure assignment of Android devices between users to ensure patient privacy, data integrity, and clinical efficiency. And so what this means is you're able to add that layer of security, add those protocols that you need to ensure HIPAA compliance and other privacy policies and regulations, but do it in a way that's absolutely effortless for your clinicians. They're extending that same badge tap that they use in other areas of the hospital now to these mobile devices. And they're able to also leverage integrations with Imprivata OneSign to provide seamless SSO into supported mobile applications so that they can quickly and securely get access to the tools that they need for care delivery. Finally, by allowing that assignment of devices in an easy way, it increases device-to-user visibility, which means you've got a digital audit trail of who's accessing these devices to ensure that you've got information about how the resources are being used in your environment. It also leads to increased accountability for clinicians as these mobile devices move about the hospital. Ultimately, what we're going to be able to help you do is ensure adoption with that ultimate optimal workflow efficiency for your clinicians so that you can leverage the investments that you've made in these mobile devices to the best of your hospital's ability. Ensuring the proper balance of security and efficiency, both from technology and user management standpoint, is critical for the successful adoption of mobility initiatives in healthcare. Often, shared use environments struggle to implement even foundational security measures due to the effect that they can have on usability of these devices. Locking down devices, as you would any other traditional endpoint, requires access controls that can be cumbersome, and yet another thing for clinicians to have to remember. Many organizations opt to leave devices unlocked, which is a major security gap, or employ the use of shared access pins for a slightly more secure approach. While shared pins do help in securing PHI, often these shared pins are less secure, too easily shared, and lack necessary auditability around who is actually accessing these devices. Making one-to-one assignment of devices and enforcing password-level security is simple and practical with Imprivata. With mobile device access, organizations can lock down shared Android devices between use, ensuring that only trusted identities have access to sensitive tools and information. Additionally, users are fully logged out of the device and applications between each use to ensure a clean state every time. Users experience streamlined access to secure devices with the simple tap of a proximity badge, similar to other workflows supported by Imprivata in their environment. This allows organizations to enforce tighter security controls, shorter session timeouts, and remove the need for shared pins and other less than optimal authentication workflows. This layer of access management for shared mobile devices enables IT organizations to implement practical security without the hassle. Simple to manage, simple to use ensures higher rates of adoption and compliance with security protocols needed for these mobile devices. Management and security challenges are only one half of the equation, though. On the other side of your mobile adoption hurdles fall the users. Ensuring that users can quickly and easily access the different tools and applications that they need on these new devices is critical to ensuring adoption of the technology. With Imprivata, we're able to increase user satisfaction by making it fast and simple for clinicians to have access to their devices and applications that they need to perform their roles. We simply log in a user with their known trusted Imprivata identity and carry those credentials into different applications. So as a clinician accesses each one of their applications, whether it's the EMR, secure communications, or something else, they have fast access without having to manually authenticate into each individual application every time. So long as they're within the defined session timeout limits of the solution, they're able to quickly get in and do what they need to do. Imprivata further helps protect patient health information and reduce the risk of errors by supporting fast user switching of these shared use enterprise-owned devices. A simple badge tap initiation will log one user out and the next user in. Not only does this ensure only, again, trusted access to the devices and applications, but it reduces the risks of clinicians accessing an application under an incorrect ID. This is something that is often a struggle when you're using shared PINs or when you're not locking the devices at all. It ensures that the device is left in the proper state for the next user within a matter of seconds, whether it's a device that's been placed down at the nursing station at the end of the shift or a quick handoff between users mid-shift for certain workflows like med administration. Regardless, we're able to make sure that in a very fast, streamlined, and secure way, user 1 is logged out and user 2 is logged in, again, all with that simple tap of the badge. Using trusted digital identity to secure and assign shared use devices allows organizations to better manage fleets across teams, departments, and locations. With Imprivata, you have improved visibility into user interactions with your shared Android devices. Through the use of device access audit logs, organizations are able to better make decisions as to how devices are deployed and distributed within their environments. Additionally, today, organizations are often budgeting for losses of between 10 to 15% of their fleet every year, as quickly responding to missing or misplaced devices is a challenge for IT and clinical teams alike. While the portable nature of these devices has tremendous benefits to clinical teams, it also makes it easier for these endpoints to go missing. Increased security and end-user accountability goes a long way in reducing loss of enterprise-owned devices. Imprivata Mobile Device Access integrates seamlessly with Imprivata OneSign, healthcare's leading enterprise single sign-on and virtual desktop access platform, leveraging the same appliances, administrative console, and other core infrastructure. So for clinical staff, this ensures a fast, familiar, and consistent authentication workflow experience across workstations, virtual desktops, and now shared mobile devices. This integration also allows IT administrators to set user authentication policies for all systems and workflows from a single centralized platform, which improves compliance reporting, reduces total cost of ownership, and minimizes the IT resources required to administer and manage authentication workflows. So right now what I'm actually going to do is show you all a very quick demonstration of what this workflow looks like that we've been talking about and how easy and simple it is for clinicians to access the tools that they need.
As you can see here, the device is locked and no user is authenticated. With the simple tap of a proximity badge, a user can authenticate and assign the device to them, as well as single sign-on into applications. As you can see here, their credentials have been pulled in and they're able to access critical tools. Again, with the simple tap of a badge, the user can lock the device and make sure that it's secure for the next use. Here you'll see that a second user is able to simply tap their badge. It will log out the first user, log in the second user, and they're able to start accessing their applications. Again, you'll see they're signed in and they're able to go about their day. Additionally, we offer fast user switching to ensure that regardless of the state that device is left in, when a new user picks up the device, they're able to tap their badge and authenticate using their credentials for each application. Users can directly log out to ensure that they manually leave their device in the proper state. And then finally, users can access the device via guest mode in the event that they don't have a proximity badge. This will enable them to manually authenticate to each application in order to go about the tools that they need.
Today, we have quite a few customers who are utilizing Imprivata Mobile Device Access to support their shared use Android workflows. We work with a number of different device vendors across all kinds of application and EMR environments. But what I want to do is really quickly highlight one of our customers who is doing some unique things with their mobile environment to help improve care quality as well as clinician efficiency. One of the earliest adopters of Imprivata Mobile Device Access is a customer, King's Daughter Medical Center. Now, King's Daughter is a great example of how organizations are looking to implement mobile technology to improve care and clinical efficiency, but are requiring to take a step back and look at what they need to put in place to ensure that they can find that proper balance of security and usability. To start off with, King's Daughters Medical Center was looking to implement shared use Zebra devices, in this case, for some of their really critical workflows. Medication administration, I mentioned a couple times, that is the one specifically that they were looking to help streamline, in addition to in-room documentation. Before rolling out this solution, clinicians were often using wall-mounted computers that were stationed within the patient room. This is a less than ideal experience because you can't always have a great face-to-face conversation with the patient while at the same time doing the documentation and gathering information that you need. So they looked to deploy these mobile devices to improve those patient interactions. They were using Meditech, and they wanted to also get quick, fast access into their Expanse environment, but in a secure way. And looking at the solution and looking at the different device options that they had, they decided to deploy Imprivata mobile device access to help support the workflows on these mobile devices in a way that was not just secure, but also familiar for their clinicians. Using BadgeTap to access traditional workstations is something that folks were already comfortable with, and so extending this workflow onto their mobile devices added a level of efficiency that made it possible to achieve the security that they needed for these devices. From a deployment perspective, it was really critical to have this workflow in place before they deployed the devices to ensure that that end user experience was as simple and as efficient as could be so that they could get the adoption that they were looking for with this new technology. We've got a great case study on our website that I encourage you to take a look at around this with more detail on their project and how they worked with different parts of the mobile ecosystem in order to get everything working. So just to recap, Imprivata Mobile Device Access is healthcare's only mobile authentication solution that enables fast, secure access to Android mobile devices and applications. Users can access shared clinical devices with a simple tap of a proximity badge and then single sign-on into their applications. Mobile device access is part of the Imprivata mobile family, which is made up of two solutions. The other one, which is Ground Control. Ground Control is our solution for iOS devices. We are aware of and understand the fact that many of our customers have multiple types of devices in their environment, some iOS, some Android, or maybe a specific patient use devices as well. So if you're somebody who has a mixed environment, or maybe you're supporting patient engagement devices on the iOS side, I definitely encourage you to learn more about what we're able to offer with Ground Control, as it is a different solution and provides different benefits for that iOS environment. We've got a great webinar that is on our website today that you should take a look at if that's something that you're interested in learning more about, or of course, as always, feel free to contact anybody at Imprivata to find out more information. That concludes our session on Imprivata Mobile Device Access. We have left time open for questions. As I mentioned in the beginning, if anybody has any questions that come up as we go through this, please feel free to enter them in the Q&A panel. We'll do our best to get to as many as we can before the time runs out.
Okay, great. Thanks so much, Rachel. This is Miriam Lizardo, by the way. I'm going to jump in and focus on answering some of the questions. We do have a few that came in throughout the course of the webinar. Some of these I know you did address, Rach, but why don't we just remind the audience? I know the first question we have here is, which devices does this work with?
Sure. So we work with a number of different Android devices. Our most prominent and what customers will likely be most familiar with are Zebra, SpectraLink, and ASCOM devices. We also support a number of versions of Samsung devices and a handful of others as well. But we've worked to build out relationships with the most prevalent device manufacturers in healthcare. If you've got a specific version that you're inquiring about, let us know and we can respond on a more targeted answer.
Great. And in line with that, next question, what kinds of applications do you support, or what kind?
Sure. So sort of similar, we work to support all of the primary applications that our clinicians will be using for their point of care or bedside workflows, as well as for things like med administration and some of the other more common clinical needs that we see folks using mobile for today. We started off focusing on supporting EMRs as well as clinical communication and collaboration tools. So we do support the majority of those tools in use today and out on the market. We also support a number of alarm management and patient monitoring applications, as well as all kinds of different workflows. So again, there's so many unique environments out there, and people are using these mobile devices for all kinds of workflows. So if there are specific questions about an application, please let us or one of your account managers know, and we can follow up and let you know whether it's actively supported today or something that we're working on.
Great, thanks. This next question is one we get quite frequently. Where do they physically tap the badge? Is it on the phone itself?
Yes, so for Android devices it is. Most Android devices have an NFC reader built right into the back of them, and so what you would do is just simply tap right on the back of that phone, around where the battery would be, and that'll allow you to authenticate to the device and go about your work.
Right. And does this take the place of an MDM?
Good question. So we absolutely do not take the place of an MDM. We work closely alongside them, and we integrate with all major MDMs in order to make sure that we can support our authentication workflows alongside them. But absolutely, we would recommend that all customers have an MDM in place to help manage their application environments and other workflows.
Okay. And for those customers of Imprivata One Sign that already have it, does mobile device access require separate licensing?
That's a good question. It is a separate license. It's a license per device, and so it's enabling that functionality for that type of device or for that environment. Customers do have to have single sign-on, whether it's an SSO/IAM license for those individual users. That's what power some of the workflows, but it is a separate license to support the mobile environment.
Okay, great. I'm going to give it one more second. Those were just the first few questions. If anyone else has anything, you can enter it now in the Q&A. I'll give you just a moment. Okay. So it looks like that's it, Rachel. So I guess that concludes our webinar for today. I did want to thank everybody for joining us, and if you do have additional questions, you can email the email that you see on your screen right now, information@imprivata.com, and somebody will get back to you. And I hope everybody enjoys the rest of their day. Thanks, Rach.
Thank you, and thank you everyone for joining.